Let's discuss esophageal varices, swollen veins in the esophagus that can rupture and cause life-threatening bleeding. Normally, blood flows smoothly through the liver. However, portal hypertension, often caused by liver disease, leads to increased pressure in the veins of the esophagus, causing them to enlarge and weaken. In esophageal varices, these weakened veins can rupture, leading to massive upper GI bleeding and a potentially fatal hemorrhage. The term varices refers to abnormally enlarged veins, while esophageal indicates their location in the esophagus. Normally, venous blood from digestive organs passes through the liver. In liver disease, increased pressure causes veins in the esophagus to expand, making them prone to rupture. Patients experiencing esophageal varices often present with severe hematemesis, or vomiting up of blood, hypotension, low blood pressure, tachycardia, a fast heart rate, and signs of shock. Additional symptoms may include melena, black stools, jaundice, yellowing of the skin, or signs of chronic liver disease. In severe cases, massive hemorrhage can lead to hypovolemic shock and death without rapid intervention. A key diagnostic feature of esophageal varices is massive upper GI bleeding in a patient with a history of liver disease or alcoholism. To manage a patient with suspected esophageal varices, provide supportive care and immediately transport them to the hospital. ALS providers should establish large bore IV access, administer fluids if appropriate, and prepare for airway management. Want to watch the full video? Watch the full video and get so much more with your full access membership by going to howtonremt.com or scanning the on-screen QR code now.